I'm Katie, nurse practitioner. So today I want to talk to you guys about cancer screening, specifically cervical cancer. Why this today? Again, I am home today working on education and I listened to a lecture about cervical cancer screening, and it kind of reminded me that I have quite a few patients that come in and are not really sure about the guidelines anymore. It used to be once you became sexually active, we started pap smears and it was every year, no matter what. Things have changed. A lot of people aren't aware of the change, so I just kind of wanted to touch on that. So, cervical cancer screening actually starts now at 21, and from age 21 to 30, we want to do our cervical cancer screening, meaning pap smear, at every 3 years, unless there's a problem or your provider says otherwise. After 30, we can go to every 5 years. Again, this is the guidelines, but it may not apply to everybody, and there are exceptions to this. What is cervical cancer screening? So that is the dreaded pap smear that everybody hates. No one wants to do it, but I'd say just get it done. It's not even once a year anymore. It's every 3 years at most, usually. And a lot of people think that this pap smear is for an STD check, or I'm not quite sure what they're thinking, but it's a cancer screening. So we're basically taking swabs and we look at the cells under a microscope and see if they are abnormal. If the cells look abnormal and they're just very beginning to look abnormal, we can do things to get rid of this so it's not a bigger problem later on. The other thing we check is for HPV. HPV in the 20s happens a lot and the body can clear it itself. So that a lot of times we don't check for HPV in the 20s. We start in the 30s. Although it's not unheard of to check in the 20s, but usually guidelines say check in the 30s. If we have HPV, then we take steps at that point depending on what the cells look like as well. It is a little bit more complicated than we ever would think. The other thing with HPV is I have gotten some women that are in a monogamous relationship for 30 years and they've always had a good pap, but now their pap is positive for HPV. They asked me, well, what happened? I'm only with the same partner. So to better answer that question is that you probably had the virus dormant and now it was already in your body and now it's being detected on that pap smear. So depending on, all the circumstances depends on what we're going to do next. So I hope this helps explain a pap smear. I don't want you to be afraid of it. Just get it done and it'll help prevent any complications. If there is a problem, we can catch it quickly ahead of time, take care of it, and it's done. Okay, bye for now.